Dear students, welcome back. In the previous session, we have seen carrying angle of the elbow. Now we are going to see the another function, that is mobility and stability. How this mobility of the joint is maintained and how the stability of the joint is maintained. How both mobility and stability is maintained during rest as well as in dynamic positions. Okay, there are number of factors that determine the amount of motion that is available at the elbow joint. So the factors which include are the type of motion. So here you can see the type of motion. So whether it is passive motion or active, and the position of the forearm. The position of forearm. Here you can see position of forearm relative to pronation and supination. Another one is the body mass index. So this is the body mass index, and also the position of the shoulder. So all these factors determine the amount of motion that is available at the elbow joint. Okay, now coming to the first one, that is the range of active flexion at the elbow. Here the range of active flexion at the elbow is usually less than the range of passive motion, because the bulk of the contracting flexors, so here this is the bulk of the contracting flexors on the anterior surface of the humerus may interfere with the approximation of the forearm with the humerus. So this is the bulk which is interfering the approximation of the forearm with the humerus. Now the active range of motion for elbow flexion with the forearm supinated is typically considered to be from about 135 degrees to 145 degrees. Whereas the range of passive flexion is between 150 to 160 degrees. So this is about the range of motion at the elbow joint. So that means the range of elbow flexion actively is lesser than the range of motion which is done passively, because actively in the active motion, the actively contracting muscles which are present on the anterior surface of the humerus interfering the approximation of the forearm with that of the humerus. Okay, so what is the range, active range of motion for elbow flexion with forearm supinated is about 135 degrees to 145 degrees. Whereas in the passive flexion, it is about in between 150 degrees and 160 degrees. Okay, next. This is the first factor which determines the amount of motion. And the second factor, that is the position of the forearm. The position of the forearm also affects the flexion range of motion. When the forearm is either in pronation, this one is pronation, as well as in neutral, that means in semi-prone position is called as the neutral position, the range of motion is less than when it is the forearm is supinated. That means here, if you can see, when the forearm is pronated or in neutral position, when that person doing the flexion, so the range in that position is less than that of when the forearm is placed in supination. When the forearm is placed in supination, so the range of motion of elbow flexion is greater when the forearm is supinated, and the range of motion when the forearm is pronated and neutral is less when compared to the forearm which is supinated. Okay, so this is the position of the forearm. Now another factor, that is the body mass index. So this is the body mass index. So that is high, that means indicating overweight, has been identified as a factor limiting elbow range of motion. What do you mean by BMI? Here it is a measure of body fat based on height and weight that applies to adult men and women, and it is also defined as the body mass divided by square of the body height, which are expressed in the units kilograms per meter square. Okay, so when the BMI is overweight or in obese or extremely obese, in these conditions the range of motion is limited. The range of motion at the elbow is limited, because if you can see here, so this is the normal BMI. Here you can see in these three cases the bulk of the arm is increased. So because of the accumulation of fat around the arm, so which are going to affect the range of motion of the elbow flexion. So the mass is interfering the approximation of the forearm on the humerus. Not only the contraction of the muscles here, the accumulation of fat which is present around the arms are going to affect the range of motion of the elbow joint. So this is the normal BMI. So in the normal BMI itself, the contraction of active muscles is affecting the range of motion. So just think, so this bulk is increased due to the accumulation of fat, or in any hypertrophied muscles like bodybuilders. So in those persons also the range of motion of the elbow flexion is affected. Okay, so some investigators have studied based upon this range of motion of 226 elbows in 113 healthy children between ages of 2 and 18. They found a decrease in elbow range of motion of 2 degrees to 3 degrees for each Z score increase. Z score is nothing but indicating an increase in weight. For every increase in weight, so there is 2 degrees to 3 degrees of a decrease in the elbow range of motion. Okay, so an AZ body mass index score of 5.6 would limit the elbow range of motion by 11 degrees to 17 degrees. So that one is the maximum. So if there is any increase in weight which are going to decrease the elbow range of motion by 2 degrees to 3 degrees for each Z score increase. So for Z score they will prescribe some weight there. For example, if you take 1 kg of weight increase, so there may be a decrease in the range of motion of 2 degrees to 3 degrees. but the Z score doesn't mention here, but you can understand like this. Okay, they may be measured in pounds also. Next, the other factor which are affecting this mobility and stability is the position of shoulder. So the position of shoulder may affect the range of motion available to the elbow because of the two joint muscles that cross both the shoulder and elbow. So these muscles, or the biceps brachii and triceps brachii, may limit the range of motion at the elbow if full range of motion is attempted at both the joints simultaneously. So that one we can see here. So the position of shoulder affects the range of motion available at the elbow as well as in the shoulder joint, because the two joint muscles that cross both the shoulder and elbow, the muscles or the biceps brachii and the triceps, here you can see the triceps and here the biceps, may limit the range of motion at the elbow if a full range of motion is attempted in both the joints simultaneously. So for example, the shoulder flexion along with elbow flexion, so both are attempting the full range of motion, then there is a limitation of range of motion at the elbow. So because of the tension which are created in the long head of triceps. Okay. So if you can see in figure A passive tension is created in the long head of the triceps by passively stretching the muscle over both the shoulder and the elbow joints, which may limit the elbow flexion. Here we can't get the full range of elbow flexion. Next, here in this pic, this one is the active tension in the long head of triceps, in the long head of biceps, may decrease and therefore limit the active range of motion in the elbow flexion because the muscle is excessively shortened by contracting over both the elbow and the shoulder. So the active tension in the long head of biceps, so the long head of biceps may decrease and therefore limit the active range of motion in the elbow flexion because the muscle is excessively shortened by contracting over both the shoulder as well as in the elbow. Okay. So these are the factors which are affecting both mobility and the stability, and some other factors limit the range of motion but help to provide stability for the elbow or the configuration of the joint surfaces. Here you can see the configuration of the joint surfaces as well as the ligaments and the joint capsule, as well as the ligaments of both medial side and the lateral side and the anterior side capsule and posterior side capsule. All these factors limit the range of motion but also help to provide stability for the elbow. So what are those factors? One is the configuration of joint surfaces, first one, and second one is the ligaments, and third one is the capsule. So these are the structures which are also limit the range of motion, but these structures also provide stability. Okay. The elbow has inherent articular stability at the extremes of extension and flexion. So during complete extension as well as the flexion, so they will have some articular stability, because during extension the olecranian process is exactly fit into the olecranian fossa, so which gives a very good stability. And in full flexion, the coronoid process of the ulna will fit into the coronoid fossa, as well as the circumference of the radius will fit into the radial fossa. So it is having the articular stability at the extremes, that means the final stage of extension as well as the flexion. In full extension, the humero-ulnar joint is in closed back position. In this position, the bony contact of the olecranian process in the olecranian fossa will limit the end of the extension range, and the configuration of the joint structures helps provide valgus and varus stability. So in this position, it also provides the valgus stability as well as the varus stability. Okay, the bony components, the medial collateral ligament and the anterior joint capsule contribute equally to resist the valgus stress in full extension. So if you can see, so this is the full extension, so this is the posterior aspect and this one is the anterior aspect. As we know that full extension, during full extension, if you see in the anatomical position, the lateral border of the ulna is deviated laterally, isn't it? So once it is deviated laterally, that means here some stress, some stretch of these structures which is creating some stress here. So that stress is called as valgus stress. Okay, so this valgus stress in full extension is resisted by the medial collateral ligament and the anterior joint capsule and the bony components. So these three structures will resist the valgus stress in full extension. And the muscles, the flexor carpi ulnaris and the pronator teres overlay the anterior bundle of the medial collateral ligament, and these muscles also give medial support of the elbow. These two muscles will give medial support of the elbow. The bony components provide half of the resistance to varus stress in full extension. So the bony components provide half of the resistance to varus stress in full extension, and the lateral collateral complex and joint capsule provide the other half of the resistance. So here you have to observe one thing, that is the valgus stress is resisted by medial collateral ligament, anterior joint capsule and the bony components, and also the muscles which are overlay on this medial collateral ligament or the flexor carpi ulnaris and pronator teres. These two muscles will give support to the medial side of the elbow. And the bony component, so this is about the medial side, that is valgus stress in full extension. Now the varus stress in full extension, that means on the lateral aspect, the varus stress in full extension is resisted by the lateral collateral complex, that is the ligaments, collateral ligaments, and the joint capsule provide the other half of the resistance. Okay, the resistance to joint distraction in the extended position. So during extended position, in full extension, there may be a slight distraction in the inside the joint. So that one is resisted by the soft tissue structures. So the joint distraction in the extended position is provided entirely, the resistance provided entirely by the soft tissue structures. Okay, and the anterior position of the joint capsule. So now we have finished the medial side, that is the valgus stress and the varus stress on the lateral side, and also the joint distraction which are resisted by the soft tissue structures. Okay, and coming to the anterior position of the joint, the anterior position of the joint capsule provides the majority of the resistance to the anterior displacement of the distal humerus out of the trochlear notch. So this ulna will have a trochlear notch through which the trochlea of the humerus is going to fixed, and over this trochlea only the notch will slides, isn't it? So what will happen during flexion and not flexion, during extension, what will happen? There may be a chance of anterior displacement of the trochlea from the trochlear notch. So that one is resisted by the anterior portion of the joint capsule. Majority of resistance is getting from the anterior portion of the joint capsule. Okay. And the medial and lateral collateral ligaments contribute a very little amount. So these are all the factors which are resisting some stresses and maintaining stability of the joint. Okay, one is the valgus stress in full extension and varus stress in full extension, and the distraction of the joint, and another one is the anterior displacement of the distal humerus out of the trochlear notch. So all these are protected or resisted by the bony components as well as the ligaments and the capsule. And another one is the approximation of the coronoid process with the coronoid fossa and the rim of the radial head in the radial fossa limits extremes of flexion. Okay, in 90 degrees of flexion, the anterior part of the medial collateral ligament provides the primary resistance to both distraction as well as the valgus stress. So we have seen the joint distraction in extended position. That one is resisted by the soft tissue structures. But at 90 degrees of flexion, the anterior part of the medial collateral ligament provides the primary resistance to both distraction as well as the valgus stress. Okay. If the anterior portion of the medial collateral ligaments become lax through overstretching, so the medial instability will result. So the medial instability will result when the elbow is in flexed position. Okay. So if the anterior portion of the medial collateral ligaments becomes lax through overstretching, the medial instability will result when the elbow is in flexed positions. So the majority of the resistance to varus stress when the elbow is flexed to 90 degrees is provided by the osseous structures of the joint. So that means the bony components and the soft tissue structures around the joint. Okay, only slight amount is provided by the lateral collateral ligament and the joint capsule. The anterior joint capsule contributes only slightly to varus and valgus stability and provides little resistance to distraction when the elbow is flexed. Okay, when it is extended, the anterior joint capsule is taking place some stability on the anterior aspect of the elbow joint, but during flexion it is having a very little importance, because they will provide slight support to varus and valgus stresses and provides little resistance to distraction when the elbow is flexed. Okay, so the co-contractions of the flexor and extensor muscles of the elbow, wrist and hand help to provide stability for the elbow during forceful motions of the wrist and fingers and in activities in which the arms are used to support the body weight. During pulling activities, such as when a person grasps and attempts to pull a fixed rod towards the body, the elbow joints are compressed. The elbow joints are compressed by the contractions of the muscles that cross the elbow joint and act on the wrist and hand. Okay, and also the swelling or pain may also limit the range of elbow motion. Okay, so these are all about the factors which affecting mobility as well as stability during a flexion and extension. Okay, in the next session we are going to see the muscle actions on the elbow joint. Thank you.